Lawrence, and welcome to everyone. It's nice to see so many people and esteemed colleagues from around the world and at McGill, and I'm looking very much forward to hearing all of our speakers today. I'm going to just give a few comments for maybe 10 minutes or so on some of the themes of this conference. I'll just share my screen so you can follow along with me. So this was this is the overriding theme, I guess, the invitation to everyone to participate. And at the risk of being overly simplistic, of course, psychoses is part of some of the main focus in some ways of this conference. There are different kinds of psychoses, as many of you know, and a lot of us are especially interested in atypical forms of psychosis, which blend in very nicely with some of the cultural discussions we've been having. There are many different definitions of culture, as you know, and there are thousands of different quotations we could use, but I think in general, talking about culture and psychoses, we're really focusing on context, bringing context into our discussion of what is often taken for granted to be a neurobiological disorder, schizophrenia and related psychoses. So that's what we're focusing on here. Just a quick quotation from Professor Kiermaier several years ago, reminding us that when we talk about culture in interaction with our clients or in research that we're doing, we also have cultures of professions, so cultures of psychiatry and of research. This is extremely important to remember that culture is not in the other that we're seeing all the time, it's in all of us as well, and that we represent various kinds of cultures and values when we come to our work, and that's been an important theme throughout the workshops and I think throughout this whole conference. A quick little bit on the history of psychotic disorders. Just a reminder that schizophrenia itself, which is so present in modern day psychiatry, some have felt it to be a fairly recent illness coming out of the 19th century. And maybe the conditions were right for schizophrenia in the industrial period, where people with irrational thinking or not very productive in a kind of industrial sense became more of concern or more of notice. And so schizophrenia, some people might feel, has sort of evolved in a dialogue with an industrial and post-industrial societies, where we focus on these kinds of problems more than in the past. And it wasn't until 1871 that the kind of classic schizophrenia-like syndrome was fully described. So it is quite recent. And then we know that the name of schizophrenia came along later in the 20th century. People have gone back and looked for historical cases of schizophrenia before the 19th century. It's been difficult to find. People find symptoms of psychosis, insanity, madness, lunacy, but the kind of insidious onset, consistent with paranoia and auditory hallucinations, these kinds of presentations have been exceedingly hard to come by in the historical records. So it just kind of implies that there's a role for culture and society in shaping of these kinds of problems. And they don't just, people have had symptoms, obviously, from the beginning of humanity, but they're shaped by the wider society. So I wanted to talk a little bit about cultural frames as well. So cultural frames is a way to talk about this dialogue, I guess, between the wider society and culture and some of the professional endeavors that we do as psychiatrists, researchers, and so on. So cultural frames really means it's talking about a way to acquire a shared meaning and interpretation of the data that we're looking at around us. And so a particular cultural community or group or society may be influenced by various cultural frames. And you can talk about cultural frames at an individual, professional, or societal level, to name a few. Let's take an example of just a quick example of what a cultural frame at a societal level might look like. So we could talk about racialized discourses over the last 200 years as a cultural frame that has wide influence in psychiatry, medicine, and other fields and disciplines. Just as an example from a paper that I presented earlier in the workshops, we could look at how cultural frames, racialized discourses, might apply to the British colonial era and then later in an era of migration to the UK. So one common theme that comes out of the historical literature is that European contact by people, say from Africa or other places, has a tendency to cause psychosis. So if you look at a quotation from 1880 from the colonial literature, the very great number of lunatics found amongst the Africans appears to me to carry some significance as bearing upon the question of the connection existing between civilization and the prevalence of insanity. So there are many, many, many examples that could be cited conveying this kind of idea. And then 100 years later, an article by Harrison et al. Espousing kind of a change, the same frame, the racialized discourse frame would be in operation, whether in the colonies or looking at people, Black people migrating to the UK in a different time and place. But so it might, the previous frame, European contact causes psychosis, might change somewhat in the evolution of these concepts and understanding, but the same frame, the cultural frame, is still in operation, these racialized discourses. And so the language changes somewhat into something like this. The most likely explanation for this epidemic is epidemic of schizophrenia in migrants, some say, is a coincidence of risk factors arising from the experience of migration from the Caribbean to Europe. So the same idea of contact causing some difficulties. And you could do this for many other kinds of historical themes come up, proneness to psychosis or African peoples being inferior to Europeans. And then the more recent discussion and dialogue might fall into maybe not proneness to psychosis so much as high rates of psychosis in the migration era, or disadvantaged social status instead of being frankly inferior. So the language changes, but the cultural frame and discourse continues to unfold itself in new and just interesting ways. So this has been part of the reason for this conference, is to examine these kinds of problems. And so our speakers today, just in conclusion, are going to be talking about and answering some questions like this. What are the social and cultural origins of psychoses? How does sociocultural context influence the symptoms and course of psychotic disorders? What does it mean to pay attention to culture and diversity in the psychiatric assessment and intervention of psychoses? And how can we make space for first-person experiences of psychosis in research and clinical practice? So with that, those are my comments. I'll just unshare. I'm looking very much forward now to how this conference unfolds. I'll turn the time back to Lawrence and our first speaker.
Great, thank you.